The Achievable Foundation had been operating for about 15 years as a nonprofit, as a gap funder for people with intellectual and developmental disabilities. Through our strategic planning work, we realized that the most compelling need that existed out there was access to health care for this population.
Achievable is different from other health centers because it was designed from the beginning to care for people with intellectual and developmental disabilities.
I've been at so many different doctors, and they've all treated me like a number. What I like about Achievable, they are people. They treat you like a human, not like a patient.
I have 3 loving kids, 2 of which are special needs. People ask me all the time, say, isn't it difficult to take care of that many kids? Because we're talking 6 years old, 5 years old, and 2 years old. But I tell them all the time, if you have the right team in place, then it becomes a lot easier. And that's what I found at Achievable. I found the right team.
When you see someone for the first time, and certainly if you're not thinking about taking care of someone with a disability, it's easy just to say, well, they limp because they have the disability, and to skip over that, even though maybe 2 weeks ago they didn't limp. And if you were curious and engaged and really trying to find the answer to what was happening with the family, you'd find out that that was a change.
The primary reason that I have found that either patients or their relatives are concerned when trying to seek out mental health services is the patients are concerned, will the clinician understand my condition?
Number 1, we're treated with respect and kindness and not like a number. That's why I love Achievable.
We often spend time as a board thinking about the future of the Achievable Health Center, not just for people with intellectual and developmental disabilities, but also for our other underserved patients.
Achievable right now is in a very unique place in that it's really at the cusp of becoming something very large.
There are over 300,000 people with intellectual and developmental disabilities currently being served by the state of California. We want to grow bit by bit and serve as many of these people as we can, along with other vulnerable populations. Provide them with the quality access health care, not only that they deserve, but that we know is possible.